It's a little bit worrisome that we've almost normalized the situation where we sort of expect 120, 130% to be essentially normal.
Montreal's emergency rooms continue to be pushed to their breaking point, with some reaching 228% stretcher occupancy rate, like at the Jewish General. Santé Québec, the province's new crown corporation for the health network, held its second assessment press conference on Friday on the situation here at Les Chum, and they specify that the network remains under pressure, particularly due to the increased traffic with patients showing flu-like symptoms.
So in the greater Montreal area, so Montreal, Montérégie, Laval, Laurentides, and Anaudière, we have shown some specific statistics, and we know that there are some emergency rooms that have very high pressure. We want to understand what's going on in those places to better support them.
The average length of stay in ERs decreased from 20.1 hours to 18.6 hours, an improvement of an hour and a half per patient.
For sure, it's still too long, okay? So I want to make sure for that. We have 1.2 million visits of patients on stretcher per year, like I said before. So an improvement of the average of 1.5 hours, it's still an improvement. Now, would we want to have it a better improvement? For sure. And we also working on that. We want to really change a few things in many institutions.
Dr. Christopher Labos says despite the small improvements, issues persist in ERs.
Most emergency rooms are still very congested. There's still very long waits, very long stays in the emergency room until people get access to a hospital bed. So we are still in a situation where things are very busy at hospitals and resources are actually stretched very thin.
To help ease patient traffic, Benoit Morin of the Quebec Association of Pharmacist Owners encourages Montrealers dealing with ailments from sexual health, travel health, chronic back pain, and urinary tract infections to visit local pharmacies.
Let pharmacists help you too. You can help them helping you. So if you need medication on a regular basis, call in advance to let the pharmacy be prepared so they can, work on more emergency things for people.
Dr. Labos notes that this influx happens every year, citing infrastructure issues and the shortages in staff as potential causes for the overcapacities.
Things are going to improve with the passage of time. The issue is more of a chronic one, is that our healthcare system just doesn't have the bandwidth to absorb a surge of patients.
In Montreal, Tehosterihens Deer, City News.